Hello, I'm Bronwyn John. I'm the Head of Service for Monmouthshire, and I want to introduce you to a short film which gives you some information about how we're returning our services at the hospital to normal. A couple of things you need to be aware of is that you will potentially need to wait for longer than you normally would for your appointment once you're at the hospital, because we have got limited waiting space and we may need to ask you to wait in your car. You'll receive further advice about social distancing. One thing I particularly wanted to mention was that please feel free to wear your mask if you wish. And I'm now going to introduce you to a range of other departments who will give you the detailed information you'll need.
Hello, I'm Julia, the Facilities Manager at Chepstow Community Hospital. We've been busy implementing measures to ensure your safety during your visit. Please make sure that you follow the one-way system around the hospital. There are floor markers to guide you. We ask that you observe the 2-metre social distancing rule when in occupied areas. When you've finished at your appointment, you'll be instructed to follow the one-way system which exits at the other end of the building. If you need any assistance during your appointment, one of our receptionists or porters will be happy to support you. Thanks for your cooperation, and we look forward to seeing you soon.
Hi, I'm Emma, the Domestic Manager at Chepstow Community Hospital. Our dedicated team of domestic staff work hard to ensure the hospital remains a clean environment at all times. High-touch areas are cleaned frequently, and you will always find sanitizer units full. We ask that you play a part in infection control by continuing to wash your hands for a minimum of 20 seconds, as this remains key in keeping the virus at bay. You can expect the same high level of cleanliness which you always have been used to at Chepstow Hospital, but if you have any queries, please stop at the main reception desk and they will be happy to help you.
Hello, I'm Sue, one of the receptionists at Chepstow Community Hospital. If you are a patient or visitor to the hospital, you may have noticed some differences since your last visit. All arrivals to the hospital must be made via the main entrance, where you are invited to sanitise your hands before entering. You are asked to stop at the main entrance desk, where myself or one of my colleagues will be able to signpost you to the department you are visiting. You may be seen in a different area to where you have been before, so please do check in before making your way around the hospital.
Hi, I'm April, Deputy Sister at Casquent Ward. Due to COVID-19, we're restricting visiting on the ward. At present, we have 2 visiting slots a day, allowing 2 patients to have a 1-hour visit. Due to there being 32 patients on the ward, this means we're attempting to book each patient a visit every 2 weeks. We understand this is very limited, so therefore we have tablets and iPads on the ward which allow virtual visiting. We can use Skype, FaceTime and Teams. We also have a ward mobile which can be taken to the bedside if you're unable to use any sort of video calling. Please call the ward and speak to myself, Sister Catherine or Sister Debbie if you have any concerns, and we look forward to welcoming you back on the ward once the guidelines has changed. Take care.
Welcome to Chepstow Outpatients Department. On arrival to the department, we will provide you with a mask and hand sanitizer in order for us to help maintain social distancing. There are new guidelines that we'll be asking you to follow. Arrive no more than 5 minutes to your appointment. We urge you to attend your appointment on your own where possible. Follow the new one-way system on enter and exit of the department. Do not be alarmed, but we will be wearing personal protective equipment. This is a product to protect our staff and patients. Now, this is the new normal. Stay safe.
Hello, welcome to the Radiology Department in Chepstow. Patients come to us from outpatients and the ward, but you will most likely be referred to us by your GP. Your doctor will give you an X-ray form and you need to phone us to arrange an appointment, which is usually within the next few days. In order to keep you safe, we will be wearing full PPE and we will ask you to wear a mask during your visit. The room and equipment is cleaned between every patient. The radiographer will explain to you how and when you will receive your results before you leave.
Welcome to Physiotherapy. The physiotherapy service at Chepstow Hospital continues to run in a modified capacity. We're currently not able to offer face-to-face appointments in the department. However, if you have been referred, we can provide video or telephone consultations. For further information, please visit the physiotherapy pages at the Health Board website, where you can find self-help advice, information on speciality services and details of how to contact us if you need to. Physiotherapy for the inpatient services continues to function as normal. Thank you.
Hi, I'm Elaine. I'm a midwife. I'm based at the Royal Gwent Hospital, but a satellite clinic at Chepstow Community Hospital. When you come to the hospital, check in at the reception. They will direct you to the X-ray department. Follow the arrows of the one-way system. When you get to X-ray, let them know you're here. You'll be handed a mask. You will then go into the midwife sonographer. After your scan, she will direct you to the midwife and you may see me and you complete the rest of your clinic appointment. You will leave in a different door.